My name is Nicolas Ravon. I'm a periodontal plastic surgeon in Beverly Hills. I'm originally from France. I was raised in Nice. I came here to Los Angeles in 1995, went to USC. I did my specialty training in periodontics at University of Washington in Seattle. I also did a Master of Science in Dentistry at University of Washington. Practiced for 10 years in the Valley, in Orange County, and finally been practicing for the past 10 years in Beverly Hills. I believe in educating my patients about their oral health, especially the health of their gums, the health of their teeth, their bite, so they can achieve optimal function, aesthetic, so that my patient can have confidence in their smile and in their life. I really wanted to choose a profession that would challenge me not only intellectually, but also manually. Dentistry combines both artistry and science, and being able to combine both is irreplaceable, and it's a daily challenge, and it participates in my growth. And then ultimately it allows really to help my patient and to help change their life. Our patient presented to the office with multiple missing teeth, mostly all of his premolars and the maxilla, as well as his canine and lateral incisors. We placed a total of 5 implants in the maxilla. These implants were CeraRoot implants, ceramic implants that were positioned in position of the premolars and canine to support bridges. As you can see, after the flap elevation, there is a lack of bone in width, and we were able to place our CeraRoot implants by widening the ridge And grafting with an allograft, we actually use mineralized freeze-dried bone as well as a collagen resorbable membrane. And then you can see the suturing. We let the patient heal for a period of 4 to 5 months, and after the period we move to the final restorative phase. Well, we scan his implant with the iTero scan. And fabricated zirconia bridges that were cemented to the implant. The patient was very pleased with the outcome, and here you can see the final result.